Good morning, class. Today we are going to discuss about your next chapter, that is chapter number 3, safety and first aid. See, in this chapter we have discussed about safety rules and we were continuing about the topic first aid. See, in first aid we have covered wounds and nosebleed. Now the next is sprain and fractures. See, in earlier lectures, I have told you what is first aid. First aid is basically the first help or the emergency treatment provided to the sick or the injured person. See, there are some precautions that you should follow when there is injury or when there are some sick. So when there is this sprain, when a person is suffering from sprain or while playing, when one get injured and he or she got a sprain, what you should do during that time? See, first of all, what is sprain? See, what happens during a sprain while playing, when we sometimes twist our joints or our legs or our foot get twisted. See, what happens, there is this torn ligament. See, ligament is the muscle basically. It is a kind of muscle that get twisted or that get teared. So during sprain, we sometimes hurt our joints or the ligaments. See, you must have seen while the sprain or while when you twist your ligament, there is this swelling. See, the leg of that person who got a sprain is swelled up and sometimes it is blue also. So what you must do during that time is basically, first of all, you should apply ice pack over the swelling so that swelling can be decreased. And if the swelling is not down, sometimes doctor prescribe some analgesics and some swelling decreasing sprays also. For example, your move also. Okay, so afterwards, what you do is, after spraying the move, after spraying move, you have to bandage the leg or the injured area in the shape of 8. See, that allows the full movement of your leg and elbow, knees and joints. So during sprain, what you must do is, first of all, you apply ice over it so that you can get down the swelling. Afterwards, you apply a spray, for example, move, so that swelling can be down or pain can be decreased. And afterwards, apply the bandage in the shape of 8 so that there is maximum movement of the joints, elbows and knees. Next is fracture. See, what is a fracture basically? During fracture, what happens? A bone is cracked or a bone is broken. See, that pain is unbearable. Even the crack is unbearable. So during that time, try to make the patient calm so that doctor can treat him or her carefully. During fracture, the first treatment you can give the person is that do not move the patient. See, if you start moving the arm or the leg which has been fractured, that may cause more injuries. So try to do not move the patient, take him or her to the doctor. The fractured area needs a splint. See, what is a splint? See, splint is a kind of the support which is given to the fractured arm so that bones can join properly. See, if there is no splint, what will happen if the bone is not properly placed? The bone will be disoriented and it will affect the person after recovery. So you should make sure that there is this splint and the bone get a proper support so that bones can be joined properly. See, for the splint, you can use a newspaper, magazine, or a card. See, next thing is a sling. During fractures, a sling is required so that the bone or the arm or the leg which is suffering from the fracture cannot be hanged down. It should get a proper support from that sling. Sling is a flexible strap which is used in the form of a lead for the support. See, in emergency conditions, you can use also a dupatta or any other long cloth so that you can give support to the arm or the leg which is hanging down. So class, this will be all for today. Thank you for listening.